following information was given by Professor Kim Woo-Ju, who works in the Infectious Disease Department at the Korea University Guro Hospital, which is located in Seoul, South Korea. He has been working in the field since 1990, and he describes the COVID-19 virus as most challenging. The origin of the virus is described by Kim Woo-Ju in the following descriptions. In December of 2019, in the city of Wuhan, which is in the Hubei province of China, there was a rise in cases of pneumonia. These cases had unknown origins and soon began to cause deaths. It was on December 31st, 2019, that the Chinese government notified the World Health Organization. It is believed that this coronavirus originated from bats in a wholesale food market in Wuhan, passed on through intermediate hosts, perhaps pangolins and snakes. It is not known for sure, and eventually passed on to humans. This virus is known as SARS-CoV-2 and is responsible for causing COVID-19. Believed to originate from a bat, COVID-19 passed through intermediate hosts and eventually to humans. This results in severe pneumonia and has a 2 to 3% death rate. Because of this new virus, there is no treatment or vaccines available as of this writing. Globally, countries are seeing explosions in the number of patients, especially Europe and large U.S. cities like New York. The death rates vary from country to country. Though we are all facing the same virus, there are different protocols imposed from country to country. There are also different levels of sophistication in healthcare as well. There are different demographics, too, that work into the equation. Countries with a higher elderly population, such as Italy, have an 8 to 9% death rate. The following statistics are current as of March 24th, 2020, and are from Korea. There have been 8,961 confirmed cases of COVID-19. 111 patients have died. 3,166 patients have fully recovered. Korea produces many tests, and of the confirmed cases in Korea, 20% had shown no symptoms. Korean patients over the age of 80 have an 11.6% death rate. Those in their 70s have a 6.3% death rate. Those in their 60s have a 1.5% death rate. Those in their 50s have a 0.4% death rate, while those in their 40s or 30s have a 0.1% death rate. As of this writing, there have been no reported deaths of teenagers or Koreans in their 20s. In Korea, 90% of the deaths are people over the age of 60. Because COVID-19 is a new virus, there are currently no treatments or vaccinations available right now. The only way to fight the virus is by your own immune system. Those individuals with stronger immune systems will fare better than those with compromised ones. The age group from teens to 40 years old may experience mild flu-like cold symptoms. These may last 1 to 2 weeks and fully recover afterwards. They may also be asymptomatic. Even asymptomatic patients, however, can still spread the virus. If a patient is over 60 years old, their immune system may start to deteriorate. This is called immunosenescence. If over the age of 80, this is much higher. The comparison is likened to that of cancer patients with compromised immune systems. If patients in their 70s or 80s, the immune system can be overmatched and cannot fight the virus. This can lead to pneumonia and inflammation all over the body. This can put the elderly in critical states and increase their chances of death. Populations with chronic medical conditions are another high-risk group, even if they are under the age of 60. These patients with cardiovascular system problems, chronic lung problems, diabetes, and those who smoke, because the nicotine can accumulate in the respiratory system. Also, these patients using immunosuppressives like steroids or cancer-fighting drugs, are at risk as well for the virus. In some cases, once patients recover, it is possible to contract the virus symptoms again. Usually when we are sick, it takes about 2 weeks for our bodies to develop antibodies to fight the virus. Once recovered, the patient doesn't get sick from the same virus again. But with COVID-19, there have been reported recovered and discharged patients regaining symptoms after 5 to 7 days. These cases are called reactivation cases. There are 3 top ways to contract COVID-19: droplet transfer, direct contact, and indirect contact. Once infected, patient may experience fever, coughing, and difficulty breathing. Cough droplets can be discharged while coughing, sneezing, and even speaking. The droplet must be greater than 5 microns and may contain many viruses. They typically land within 3 to 7 feet. If shouting or screaming, they reach up to 9 feet. They can affect your eyes, nose, and mouth, as these contain mucous membranes. Transmission through direct contact: patient may wipe nose or sneeze into a hand, then shake hands, spreading the virus. Droplets that were coughed or sneezed out may also land on tables, doorknobs, and keyboards, etc. COVID-19 is able to survive a few hours to beyond 3 to 4 days. It depends on the temperature and the humidity of the environment. An environment of 40 to 50 degrees Fahrenheit with 30% humidity can survive up to 5 to 7 days on a tabletop or similar surface area. The virus does not live as long on paper or fabric surfaces. Droplets can also shrink and dry to less than 5 microns, turning them into aerosol transmissions or airborne transmissions. These are very light and less prone to gravity and may travel several feet from the infected person. That is why closed-in areas like churches and restaurants where people talk and eat are high-risk areas. Areas like parks and recreational open areas pose less of a risk due to the openness of the area. You should get checked if you experience symptoms: fever, coughing, or difficulty breathing. The elderly population and other high-risk groups should be even more vigilant. In Korea, you can purchase a test, and if the test results are positive, you will be reimbursed. The virus cannot pass through intact skin. It can enter your body through your eyes, nose, and mouth. This is because of the receptors in these areas known as ACE2 receptors. The virus sticks to these receptors. There are none of these receptors on the skin, and the virus is unable to enter the body through the ears. The wearing of a mask is beneficial whether you are infected or not. Healthcare providers that wear masks are less likely of contracting the virus than those healthcare workers that do not. The United States has less mask wearing in the public. It is not encouraged to prevent possible mask hoarding, keeping more of a supply for the healthcare workers. A KF94 mask is similar to an N95 mask, and in Korea, almost everyone wears masks. This greatly helps reduce the spread of infection. In Korea, there are approximately 15,000 tests done daily, with 338,000 tests done to date. Korea has experience with dealing with viruses, as they had the swine flu in 2009, MERS in 2015. Tests can be made right away using PCR or polymerase chain reactions. Wearing masks and washing of the hands helps to prevent the spread of the infection. The core of prevention: to quickly produce tests and to make them readily available, to gain knowledge of the patients being tested, those with positive results, information that will result in either treatment or quarantine, to find out where the patient has been and whom they've had contact with. Then to test those who were in contact with that infected person, and to decide whether treatment or quarantine is necessary. Patients that are tested, those testing positive, will be evaluated. If critical or serious conditions apply, they are sent to the hospital. If the condition is less serious, they will be sent to a health treatment center. If the patient has a negative test result, they can go home. They will be required to self-quarantine for 2 weeks. They will be asked to use an app on their phone to keep track of their quarantine and will have to enter data twice daily. If they should attempt to leave the quarantine area, an alarm will sound and they will be contacted by the healthcare professionals. What's best to do? Wash your hands well, wear a mask, and practice safe social distancing. Every individual needs to do their part.